Hello, my name is Danny Ponder, and I'm a wellness coach for Blessing. I've been with the program since this last January, so almost a year. Today, we're going to be covering diabetes. I chose this topic because November is National Diabetes Month, so we'll go ahead and dive right in. Um, what is diabetes? Diabetes is when the body does not make enough insulin or does not properly use insulin. Um, as we get further into the slideshow, we will break down the different types of diabetes, but basically the general basis of diabetes comes from insufficient insulin production, no insulin production at all, or the resistance to insulin's effect. And this can basically result in high blood glucose levels. What is diabetes continued? On the next slide here, we have, as a result, your high blood glucose builds up in the body and spills into the urine and then out of the body, which then the body then loses its main source of fuel and the cells are deprived of glucose. Glucose is basically a very high key energy source for us, also known as sugar. High blood glucose levels may result in short and long-term complications over time. It actually affects about 37 million Americans. So, moving on to the next slide, like I said previously, there are three types of diabetes: type 1, type 2, and then gestational. So we'll talk about type 1 first. This is basically an immune system disease. The immune system is the body's main system for fighting off infection. So a pretty important system that is compromised. The immune system attacks the beta cells, which are insulin producing of the pancreas, and then destroys them. As you can see on the image that I've attached on the slideshow, it compares a healthy pancreas to a type 1 pancreas, and basically the pancreas fails to produce insulin, which then fails to go to our cells. The pancreas can no longer produce insulin, therefore with the type 1, you would have to take insulin daily. Children and young adults are most likely to develop this type, and then type 1 accounts for about 5 to 10% of the diagnosed diabetics in the US. Moving on, symptoms of type 1 diabetes: increased urination, fatigue, weight loss, increased thirst, increased hunger, blurred vision. Cause is uncertain, but professionals seem to think it's either genetic or environmental. Moving on to type 2. This is the type of diabetes that is insulin resistant, basically meaning that the body is resistant to the amount of insulin that the body makes. As you can see, I put up another image comparing type 1 and type 2, so you kind of have a visual of what the pancreas can and cannot do between the two types. So when you have this type, the body needs to it needs increasing amount of amounts of insulin to control your blood glucose. The pancreas tries to make more insulin, but over time insulin production may decrease. Now moving on to the symptoms, they are very similar to type 1, so it might be very difficult to diagnose without a doctor's advice. So if you have any of these symptoms or have recently experienced any of these symptoms of that are listed, which, like I said, type 1 and type 2 are very similar, I would definitely try and see your primary care physician. Age of onset for type 2 is most commonly found in adults, increasingly common in children recently, people who are overweight, and then people who are also inactive. Moving on to our third type, gestational diabetes. This occurs or develops when you are pregnant. So it affects how your cells use sugar, and usually this is tested on women between 24 and 28 weeks, and we'll talk about how it is tested in a couple slides. Expectant women can control this type of diabetes by eating healthy foods, exercising, and then sometimes taking medication as well. Controlling your blood sugar can prevent a difficult birth and keep you and your baby healthy, which is the main goal during pregnancy. So it's always good to catch it at that 24 to 28 week mark, because usually that's when it develops, so your doctor can help you manage it through the rest of your pregnancy. Once your pregnancy is done, or after you have delivered your baby, blood sugar can return to normal, although you are more at a higher risk of type 2. All right. Complications with gestational diabetes is excessive birth weight of the baby, early preterm birth, low blood sugar for you and the fetus, and then like I said, you can develop type 2 later in life, and then you can also have high blood pressure throughout the pregnancy as well. Risk factors usually occurs in people over the age of 25, overweight or obese, inactive individuals, and if you have actually delivered a baby who weighed more than 9 pounds, or if you had an unexplained stillbirth in the past, professionals have seen connections to that as well. So like I said, we would talk about diabetes diagnosis later on. We're going to talk about that. There's 2 different ways that it's usually diagnosed. The most common way, which if you come to a core health screening, we usually get a little blood sample and put it in our machine. It's going to run your glucose level. Usually you're going to fast for 10 to 12 hours, so we get an accurate result. And as you can see here, I have put down the what you want that blood sample to come out at. We want that number less than 100 milligrams per deciliter. That is kind of that normal range. And then 100 to 125 milligrams per deciliter is considered pre-diabetic, and then anything greater than 126 milligrams per deciliter on 2 different tests taken is considered diabetic. And then the other one, which is probably most common during pregnancy, you will take an oral glucose test, which after fasting, again for 10 to 12 hours, you'll consume a sugary drink. I kind of compare it to like a Kool-Aid or a really sugary Gatorade, and your blood sugars are tested periodically through the next 2 hours. Usually want to see, since you are consuming sugar during that time, that blood sugar to be less than 140 milligrams per deciliter. That's that normal range. And then 140 to 199 is considered pre-diabetic, and then anything over 200 after 2 hours indicates diabetes for sure. So that's kind of how they diagnose, and then sometimes they'll even take you to get an A1C test, which we'll talk about here in a minute. Moving on to diabetic management. It can be managed once you have it, but it doesn't always go away. Unfortunately, the main goal is to maintain target range for your blood glucose, and it's also very important to follow up with your provider to have glucose level goals. Having optimal blood glucose helps to promote normal growth and development. And research has shown that maintaining blood glucose levels within the target range can prevent any delay of the long-term difficulties of diabetes, and that includes heart attack, stroke, blindness, kidney failure, nerve disease, and even amputations of the foot or legs. All right. A little bit more about diabetes management. Maintaining good blood glucose control is a constant juggling act, so you're constantly 24 hours a day, 7 days a week, juggling that constant maintaining, trying to figure out what your blood sugar's at, what you're eating, will it raise my blood sugar, will it decrease my blood sugar, and stuff like that, okay? The key to optimal diabetes is to control a careful balance of healthy food, exercise, and insulin and or medication. Things to keep in mind: food makes blood glucose levels rise. Physical activity, insulin, and or oral medication can decrease your blood glucose levels. And then stress, illness, and or injury can affect glucose levels as well. Moving on to diabetes prevention. Couple key things here that you've probably heard before. Eating a healthy diet. You want to eat in moderation. We really want to increase whole grains, fruits, veggies, and then reduce the intake of sugars and saturated fats. And then exercise definitely helps, trying to get 150 minutes of exercise a week. Controlling stress levels, that is definitely going to help as well. Really want to reduce the amount of smoking and alcohol use. And then seeing your physician for regular checkups. So going to your primary care physician to have your annual tests ran to rule out anything, especially diabetes in this case. Moving on to our last slide here, just a little takeaway from here. Know your diabetes ABCs. A1C, like I said, we would talk about earlier, is just a hemoglobin A1C test done, a more in-depth glucose test. It's usually taken at a 3-month average of all your blood glucose levels. Your doctor will have you come in every 3 months, have that ran, and kind of see where you're at to help you manage your glucose levels. Blood pressure, we want that below 140/90, so it's important to keep track of that as well. Cholesterol plays into a factor. LDL, which is our bad cholesterol, we want that to be less than 130 milligrams per deciliter. And then same with our HDL, which is our good cholesterol, should be more than 40 milligrams per deciliter as well. And lastly, S for smoking. Those who smoke have a 30 to 40% higher risk of diabetes to non-smokers, so very important that we try to lower the amount of smoking that we do if you are a smoker, or even if you are diabetic and you smoke. That is my last slide. So thank you guys for watching, and I hope you learned something about diabetes and how we can prevent it. Our health team, wellness team here is always here to help. So if you ever have any questions, don't be afraid to reach out. We also have our diabetes program as well. So that's it for today. Thanks for tuning in, guys.